Good morning, everyone. I am Dr. Ajay Singh, Thakur, Associate Professor, Department of Orthopedics. So today we will discuss complications of fractures. As you all know, that fractures are fairly common in today's world. Mostly they result because of trauma, but we'll be focusing on complications of fractures. Now, the complication of fracture can be broadly divided into general or systemic complications or the local complications, which can be early or late. Now, starting with the general complications, as you all know, the fracture can be associated with shock, hemorrhagic shock, or a hypovolemic shock. So, whenever there is a fracture, it is associated with trauma. If trauma is very high velocity, or there is an open wound, or there is a vascular injury associated with the fracture, patient can go into hemorrhagic shock or a hypovolemic shock. And sometimes this are the open wounds associated with fracture, which can get easily infected and later on which can convert into a state of septic shock. We will not discuss this individual complications. We'll just enumerate it in today's lecture and we can discuss it further. Now the next thing is, we can, as you all know, the fracture is a very painful condition. So in case of polytrauma patient, the patient can easily go into a state of neurogenic shock. Also, there are other systemic complications which are associated with fracture, especially with fracture of long bones, which are like fat embolism, or the blood clot itself can get dislodged from the injury site and go into a systemic vasculature leading to pulmonary embolism. Now, there's something you should be very afraid of, that is pulmonary embolism. Coming next is, whenever there is a high velocity trauma, there is a crush injury of muscles and other soft tissue, which can lead to the crush syndrome. As a result of all this complication, the patient may go into a multiple organ failure syndrome. And there can be other complications like tetanus or gas gangrene formation, which can be harmful for patient and can cause death at a later stage. Now next is local complications. Now local complications can be early whenever there's a fracture of rib or spine. There can be associated visceral injury, especially the lungs, bladder, urethra, rectum. Urethra and rectum are most commonly injured in a pelvic fracture. Always there is chance of rupturing of blood vessels, and which can cause a vascular injury, or patient limb may be compromised because of vascular injury. So these injuries are very severe and have to be dealt with immediately. There can be associated nerve injuries, especially in fracture of proximal tibia, like for example, common peroneal nerve is at risk, and whenever there is a fracture of comminuted fracture of hip, the sciatic nerve can be at risk. In the fracture of forearm, the ulnar radial nerve. The radial nerve is the most commonly nerve injured, especially it happens in the fracture of distal humerus. Now there can be a compartment syndrome. Whenever there is a fracture, there is a local bleeding, local soft tissue injury, and when it is limited closed, especially when it is closed injury, there can be rise of the intercompartmental pressure, which can cause a compartmental syndrome. When the fracture is in the joint itself, it's called articular or periarticular fractures. You can get a hemarthrosis in this. Also, risk of infection is always there, more in the open fracture and less in the fracture. But yes, the risk is there. Whenever the injury is severe, it can be Associated gas gangrene can be local complications of skin, which are known as fracture blisters. And sometimes the injury can be because of the treatment. Whenever a tight plaster is applied, there can be a plaster or pressure sores. Now, some of these are early complications, but yes, like any other disease, there can be delayed complications in fracture because of multiple factors, which are enumerate with are delayed union, non-union, malunion, avascular necrosis. There can be growth disturbances. There can be bed sore, especially when the patients are bedridden for a long time. There can be myositis ossificans. Muscle contractures can develop at a later stage. There can be a tendon lesion which can occur due to malunion or non-union. There can be a nerve compression or entrapment of nerve in the fracture callus. And also, whenever there is a fracture, there can be associated soft tissue or ligament injury, which can lead to joint instability, joint stiffness, and at later stages, we can get something called CRPS or complex regional pain syndrome. Now, as we all know, osteoarthritis can be secondary and very easily associated with post-traumatic complications of fractures. Now I have enumerated the complication of fracture. Now we'll discuss with injury. Now coming back to early complications, see whenever there is a fracture of rib or multiple ribs or fracture of pelvis, there can be local or vascular injury. The broken rib can easily lacerate to a lung tissue, or there can be collection which is known as pneumothorax, which can compress the lung tissues. Also in pelvic injuries,